I'm Dr. Obey, and this is A Moment in Medicine. Our focus is health, education, and wellness. Our goal is for each and every one of us to have that opportunity to grow old in good health. Welcome to our show. Well, we have a great one for you tonight. We're going to talk about that little thing in the abdomen. It sits right about here. It's called the gallbladder. And I have an excellent physician here to talk about it, and we're going to cover it. We're going to cover it from A to Z. But before we start that, remember my old saying, sharing and caring. You got to share your med moments. You got to care about others. And if we put it all together, we all can have better health. Remember, OBHealthy.com. That's our website. Go ahead, email me. Let me know what's going on out there. And hey, we have Facebook now. Hey, Obey Your Doctor. Hit me up on Facebook. Let me know what's happening. Or check out my Facebook. Sometimes I give medical tips out. Or you can go to the website and get more education as far as medicine is concerned and your health is concerned. Well, our topic tonight is the gallbladder. And we're going to talk about why this particular organ and where it is, what it does, why it does it. And it's very important, but it often gives us a little bit of problem. And Dr. Kevin Clark is here. He's a surgical oncologist, and he's going to talk and tell us everything we need to know about this particular problem, the gallbladder, when it gives us a problem. Dr. Clark, welcome to our show.
Thanks for having me.
All right, so you're becoming a seasoned veteran on this show because all of your topics are just so important. So I would like to start off with the first question. And that is, what is a gallbladder? Tell me what it is.
Well, the gallbladder really, it's an organ that sits right underneath the liver, and its main function really is to store bile. And bile is a substance that the liver produces to help with digestion. Right. So after we eat, what happens is the gallbladder contracts, it releases bile, and that goes into the intestine. Right. And that helps us to digest food.
Okay. So I'm getting an understanding here where this is. It sits right under the liver, you said. So then it's associated with is it the small bile or the large bile? Where does it dump the bile? Where does this gallbladder dump the bile into? Where? And as far as the bowel is concerned.
Well, it's actually connected. So it's a part of the biliary system, and the biliary system, it's big words. It's really piping. So it's piping that directs bile from the liver, and then that bile goes into the gallbladder and gets stored. Okay. And after we eat, then it gets released and it goes again into the same piping into the small bowel, the first portion of the small bowel called the duodenum.
Duodenum, right. Okay. All right. So the small bowel is made up of, this is a good question. The small bowel is made up of how many segments and what are they called? It's
really 3 segments. Okay. The first segment is the duodenum, which is the continuation after the stomach. Right. Then it goes on to the jejunum, and then the ileum. So those three structures make up the entire small intestine.
Okay, and let's just step back for a minute and talk about the small intestine, because I think this is important. The small intestines is where we actually absorb or all of our nutrients from our food and stuff like that?
Correct.
Is that the place?
Correct. So the small intestine is the largest segment of the intestinal tract. Okay. And that's where the majority of absorption of nutrients occurs.
Okay. So when I eat, if I don't have a small intestine, then I'm really not absorbing all the products from the food that I need to live.
Correct.
Okay.
Correct.
All righty. How long? These are just questions that I just come up with. How long is our bowel?
Well, the small intestine itself is about between 12 to 20 feet.
Feet?
Feet.
Wow.
Right. So if you stretched it out, it would be between 12 to 20 feet. Wow. The large bowel is about anywhere between 4 to 6 feet. So small bowel is definitely much larger than the large bowel, and that's in fact because its function in terms of absorption is much more important. Okay. The large bowel functions more to reabsorb water and to store, to compact stool. Okay. Whereas the small intestine is really where the majority of the nutrients and digestion occur. So.
Excellent. Well, what about as far as bile now? What does it do? Does it help break down the foods, or does it? What's its function?
So it really helps us to break down and digest fats or lipids.
Oh,
so
all right.
that's really the main function of it.
Okay.
And it gets released into the small intestine. It interacts with the lipids, allows us to break it down and absorb it, and then it gets recirculated back into the bloodstream, back to the liver.
So we really never use it.
Well,
Lose it. I mean.
Some of it you do lose in the stool, but some of it is also reabsorbed.
Okay. All right. Now I was reading somewhere that bile is like mostly water.
Yes. Yes.
All right.
The majority of it is water. The components actually, it's majority water, bile salts, bilirubin, and cholesterol. Those are the main components, along with a few other things, but those are the main things that make up what we call bile.
Okay. All right then. Why does the gallbladder give us such a problem all the time? I mean, you always hear about, oh man, my gallbladder's acting up.
Right.
Why does it give us such a problem?
Well, I think it's mainly due to gallstones, and that's usually where the majority of symptoms come from.
Right.
Now, gallstones, there are a couple different types of gallstones. So usually when we say gallstones, we mean mixed cholesterol and pigmented stones, which is the most common type.
Okay.
But you could also have strictly pigmented gallstones.
Pigmented, but what do you mean by pigmented? Like got some ink in it or something?
So the reasons why we form gallstones, and this is not completely known, but it's really because there's an imbalance between the components that make up bile.
All right.
So if there's an imbalance and the components are not at the correct level,
Right.
there's a tendency for them to form stones, essentially.
Okay. Is it like calcium forming or something like that? Like
Similar.
kidney stones are usually calcium, I know. But is it similar to that?
Similar type of process.
Okay.
And then when I say pigmented stones, those stones are the majority of the makeup of those stones are going to be from bilirubin products, as opposed to the more common stones that we think of, where it's a combination of cholesterol and bile.
Okay, so what you're saying is bilirubin is what makes it green or
Right.
greenish?
Greenish color.
Greenish color. So that's what you mean by pigmented.
Pigmented
It's
stones.
more greenish color or brownish color
Right.
when you see the stone, so you know it's more pigmented.
Pigmented stones, right.
And then the cholesterol is a lighter stone.
Right.
Okay, all righty. Now, this bile, when it comes into the gallbladder, when we eat, the gallbladder, what is it? It has a muscle and it just excretes it, pushes it out?
So what happens is it's a coordinated reaction.
Okay.
So as food travels through the intestine, there are substances that are released that signal the gallbladder to contract, so that it now releases the bile into the intestine to combine with the food that's there to help with digestion.
Okay.
So it's a coordinated reaction that's based on food traveling through the intestine.
Okay. Now you said that where is bile made? You said
It's
something
made in the liver.
in the liver.
Right.
All righty. So I know the liver does a whole lot of things. It purifies the body and all this kind of stuff, but it makes bile as well. All righty. And it's a continuous, and the gallbladder just stores it up and waits there for the food to come down.
Correct.
Okay, that's cool. That's cool. How does the pancreas play in this? Does that affect the gallbladder ever? I know the pancreas, when we're getting fancy here, the liver sits here, the pancreas sits here, and the pancreas is an organ that allows us to secrete insulin and stuff like that for the diabetics. So, but does that have an effect with the gallbladder?
Well, it also plays a role in digestion, and it secretes enzymes also that facilitate the digestive process.
So it breaks down food by the enzymes. Enzymes are those things that kind of chew things up.
Right.
And they help break down food as well as the bile when it hits the gut, and then we absorb it back.
Right.
Interesting. So I'll be looking pretty buff here if I eat the right things, right? Okay. Let's get some definitions out. Cholecystitis.
So,
and that's a big word.
Right.
Hopefully I said it correctly.
No, that's correct. It's a big word, and essentially means infection of the gallbladder.
Okay.
So it means that there is a process that's happening that's allowing the gallbladder to become infected. And typically that's from gallstones. That's the most common cause of acute cholecystitis. Now, there's also chronic cholecystitis.
Okay.
Acute is defined as an episode that lasts a few hours to days, whereas chronic is a recurrent situation where you get gallbladder attacks over months to years.
Okay. So every time you eat a fatty meal, you know what I mean? Because gallbladder, you said, help break down the lipids and the fats.
Right.
So if I eat a big fatty meal, a big bucket of fried chicken,
right.
I'm going to feel it.
Right. And that's one of the things that we look for. So when we suspect that somebody has a problem with the gallbladder or their abdominal pain is associated with the gallbladder, we ask them specifically, when did the pain occur? And if they tell us it's after I had a particular meal, then put those two things together, and the most likely cause is from the gallbladder.
Okay. Another big word, cholelithiasis.
So cholelithiasis is another word for gallstones.
Gallstones.
Right.
Oh, all right then. Because I know sometimes you're at the doctor and they throw these words out. Oh, you got a cholecystitis and and you're saying what? You know what I mean? So to give an understanding, so cholecystitis is inflammation and infection.
Right.
Cholelithiasis is the stones in the gallbladder.
Correct.
Excellent. Excellent. Is it more common in older people? Can this occur in young?
It's yes and no. So it can occur in young patients, and typically the young patients who get it are the ones who have problems with bilirubin breakdown.
Okay.
So they tend to have the pigmented stones. Those are the patients who have problems with hemolysis or breakdown of.
There you go.
Yeah.
Man. You're going with those words again. Hemolysis is you're breaking down the blood cells.
Correct.
And that has pigment in it.
And that has pigment.
Gotcha.
So if there's excess, if that process is aberrant, then you have excess bilirubin in the system, and they tend to form pigmented stones.
I got you.
Also, patients who are obese, so young patients who obesity is associated with the development of gallstones also. So those two groups you are more likely to get gallstones in the young population.
Right.
In general, across the board, females tend to get it more than males. Age really is not a defining feature of gallstones. But it's really, there's the demographics actually who really gets it. It's females in their 40s who tend to be overweight, I won't say fat, who are fertile.
Okay.
So the 4 Fs, so to speak. And that's the classic demographic of who gets gallstones.
So female, fat, fertile, and 40?
40, yeah.
Okay, I got you. I'll say fat.
All right.
Okay, here we go. As far as in your practice, how would somebody present that would have your antennas go up saying, this patient may have gallbladder problem?
So one of the things is we look for, first of all, the location of the pain. So the location, gallbladder symptoms usually occur right upper quadrant.
Okay.
So right upper quadrant is this part of the abdomen, and that's where the gallbladder sits. It sits right underneath the liver.
Okay.
Now, it typically occurs in relation to food. So after you have a meal, then the pain comes on. And that kind of gives us an indication that it may be coming from the gallbladder. Now, to differentiate if it's acute cholecystitis versus something that we call biliary colic or symptomatic cholelithiasis. Now again,
okay, I got you.
I'm going to explain it.
Okay.
The reason why there's problems with the gallbladder is because we think gallstones obstruct the flow of bile from the gallbladder.
Oh, okay.
So that obstruction causes the gallbladder to expand, and that expansion is what causes the symptoms. Now, that expansion could be intermittent. So if it comes and goes, then we call it symptomatic cholelithiasis or symptomatic biliary colic.
Right.
If that obstruction is persistent, subsequent infection can happen, and then that's when you get acute cholecystitis. So the timing of those two things, and clinically we differentiate them. Acute cholecystitis tends to be persistent.
Right.
The pain tends to be a little bit more severe. and they typically have changes in their chemistries. Their blood count typically goes up, which is a reflection of infection.
Right, right.
And the hallmark really is we do an ultrasound, abdominal ultrasound,
All right.
and we put it in this area. We look at the gallbladder.
Right.
Now the gallbladder is normally not distended. There's usually no fluid around it.
This is a normal gallbladder you're talking
Right.
about. Okay, okay.
A normal gallbladder is not distended, doesn't have fluid,
Right.
and it's a normal size, essentially. A gallbladder that's inflamed or infected, it's much larger.
Right.
There's what we call pericholecystic fluid, or fluid around the gallbladder, and it's a lot thicker. So those are the findings that we look for on ultrasound, and that really nails the diagnosis of acute cholecystitis.
All righty. Is there a way that you can, through colonoscopy or something like that, go to that area and get those stones out? Is that possible ever? I mean, if it's blocking, like you say?
Right. So the treatment really, for episodes of acute cholecystitis, really is to take the gallbladder out.
Okay.
So if you take the stones out of the gallbladder without taking the gallbladder out itself, they tend to recur.
Okay.
So you really haven't fixed the problem. Right?
Can it ever get better on its own?
Yes. So episodes of acute cholecystitis, we always start off with treating them with antibiotics, bowel rest.
Okay.
And the definitive treatment is to take the gallbladder out. Now, there's some patients, for whatever reason, we can't do it immediately, and we treat them conservatively with just antibiotics. And some people do resolve. Now, that resolution is temporary because eventually, again, they'll, a few months down the line, or even a few weeks, get the same problem again. So it can resolve on its own with just conservative management in the acute phase, but the recurrent disease, you can expect that this will occur again.
It's going to come back again. Yeah. Are there many symptoms like nauseousness and vomiting or diarrhea with this?
Not really diarrhea with cholecystitis, but you can, there is some nausea and sometimes vomiting associated with it. So.
Does the gallbladder, I mean, when all of this is occurring, what about the organs around it, like the liver and the pancreas and the small intestines themselves? Are they affected by it? I mean, can this bile fluid back up to the, you know what I mean? Like you have it up to here,
Right. Well, the gallbladder itself can become inflamed to the point where it gets stuck to things around it. So secondarily from the inflammation and infection, it could stick to the small intestine, the colon, the stomach. So in that sense, yes, it can cause problems with other organs just from direct contact and extension. The function itself is really separate from those organs. Now, there's a condition where the gallstones leave the gallbladder and go into the tubing, actually the piping, that goes into the small intestine. And if that stone gets stuck there, then it can build up and back up to the liver. And then that can cause a problem now with the liver. That's called choledocholitis. And that's a big word for saying that the gallstone now is not in the gallbladder, but it's in the duct that goes into the small intestine.
Okay, all right. And it backs up the whole plumbing system.
That could back up and actually cause a very serious infection.
Okay.
Also.
So it can cause a serious infection in the gallbladder, in the liver, and maybe even the pancreas if it backs all the way up.
Actually, the gallstones itself, as it passes down, we think can also cause pancreatitis.
Oh.
Yeah. So that's one of the causes. It's called gallstone pancreatitis. So the gallstones now, as it leaves the gallbladder, it travels down that same tubing into the small intestine. The theory, and this is still ongoing, is that it transiently obstructs the pancreatic duct, and that can cause inflammation of the pancreas.
So all of these organs have ducts that kind of lead down to this common pathway that goes into the intestines, or the small bowel. And if anything backs up, then all of them can be affected.
Correct.
What about other diseases? Say diabetes, hypertension, things like lupus, or all these fancy diseases out there. If you have one of those diseases, are you more prone to have gallbladder disease?
So patients who have the category of the hemolytic anemias.
Okay.
And then we can get back to the breakdown of bilirubin and the excess bilirubin and the pigmented stones. Those patients are more.
So we're going to just say again what hemolytic anemia is. It's the breakdown of red blood cells.
Right.
Because red blood cells have bilirubin in
Right.
them. So I just wanted to make sure because that word is a big one.
So those patients are more prone to developing gallstones.
Right.
So sickle cell patients, patients with thalassemia, those patients tend to get pigmented stones.
Gotcha.
Patients after gastric bypass surgery, for whatever reason, they tend to develop gallstones. Obesity is also associated with gallstones. Diabetics get everything, but they tend to get a particularly virulent form of cholecystitis, and it can progress to the point where it's acutely life-threatening. It's called emphysematous cholecystitis.
So they have to have the gallbladder out right away.
They actually, well, in some cases, they're so sick that you can't take the gallbladder out, and you have to temporize them with other measures. But they're a particular group that tends to get, when they get an infection, it can be very severe.
Right.
The gallbladder. Everybody else, I can't think of offhand of any other particular groups that are more prone to getting gallstones or not, besides those particular subsets.
Particular patients. All right then. What about as far as, now you had mentioned ultrasound, and I know that we have all these fancy MRI and CAT scan, ultrasound. Describe, and I understand they give you a good look at everything in the body.
Right.
Describe an ultrasound, how it's like if somebody was looking at, like if a female was pregnant and they're looking at the baby, it gives you a picture. Describe what they actually see and how they see it on this.
So the best way to describe ultrasound really looks for particular changes that occur in the gallbladder or the surrounding system. So we know what the normal looks like. So we look for things that vary from that. So anytime there's fluid is abnormal. Okay. Now fluid could be from other things, but in the context of pain, you associate it with cholecystitis.
Okay.
The thickness of the gallbladder also is a sensitive measure of inflammation. So as the gallbladder gets thicker, that's also a sign of infection or inflammation.
Right.
And that thickness could be readily measured by ultrasound. The piping that I was describing before, the diameter of it also can be measured. And the diameter itself is a surrogate marker for whether or not there's stones or obstruction in the system. So all these things we can measure on the ultrasound, and we can infer based on the results of what's going on.
Okay. When you see an inflamed gallbladder and stones, is it just usually just one stone, or is the gallbladder just filled with all like a whole lot of diamonds?
The majority of the time it's multiple stones.
Really?
You can't have one large stone that's actually obstructing, but the process usually involves multiple stones.
Right. Tell me about this. There was something that I read that if you have pain here in this area of the gallbladder and it radiates up into your right shoulder, then that's a sign of that maybe. What does that mean?
Well, that's referred pain.
How do you get pain up here?
Well, that's referred pain. I think
pain.
A lot of the organs have what we call visceral innervation.
Right.
So you don't necessarily, until the inflammation actually extends to I'm going to use another big word here, the parietal or the surface covering inside, you can't really localize it. So you could have inflammation in an organ, and it won't localize to that particular area until it touches that top part. So you'll get that sensation somewhere else, which is odd, until it localizes.
Until it localizes. Can it burst? Can
unusual,
get
but
so big that it pops?
Unusual, but it can happen, and that those patients usually present a lot sicker. Again, the diabetics are the ones who are predisposed to developing perforations with those illnesses. Fortunately, it doesn't happen very often, though.
Okay. Yeah. We only got a little bit of time left. describe surgery for this, because that's the deal. Everybody's going to the OR.
Right. So it's the classic procedure is called a laparoscopic cholecystectomy.
Okay.
And laparoscopic means we use small incisions and we use the camera to take it out, basically. It's typically, although it's gotten to be same-day surgery at some point, but for the most part, you're in a hospital a day or so. And we take the gallbladder out, usually through 3 or 4 incisions, and the largest incision probably is about this big.
So you don't get that big scar across your abdomen anymore?
It's unusual for us to actually have to do what we call the coca incision, which is a large subcostal incision, which we know is very painful. And actually, your ability to see and take the gallbladder out is much better with the camera than actually making that incision.
So you actually put scopes in and
manipulate
it and pull the gallbladder out.
And actually, it's one of the, it's, if not the most common procedure that's done in this country, in the top 3.
Okay.
So.
Dr. Clark, as usual, it was a pleasure. We've run out of time.
Same here.
Thank you very much. Excellent, excellent. Well, let me tell you, in closing, remember, OBHealthy.com. That's our new website. Go there. Find out medical information. It's all there. I just want you to go and educate yourself, because we all want to be an educated healthcare consumer. Also, Facebook, Obey Your Doctor. Never institute any change in your medical therapy until you consult your physician. I trust each and every one of you. Continued good health. I'm Dr. Omar Bey, and this is A Moment in Medicine. Until next time, peace to you all. All right. Excellent, excellent.